Hi, my name is Francis Beltran. I am a community health worker, a Promotora with the Riverside Community Health Foundation. So back in July 11, 2005, 20 years ago, I started as a Promotora. It's like an extension of what I did before in Mexico. I was Promotora in Mexico, but I didn't have the resources and all we have now here for the community. So when I started and I see all we have for the community, I said, let's go, let's get to work. My favorite part working for RCHF has been like I got the benefit of health. I improved my health physically, mentally. I feel better now than when I was younger. Lately, I talked to my husband about the National Diabetes Prevention Program, and I found out that the A1C was in the borderline. So I talked to him about that program, and he accepted to take my first sessions in English because I usually teach Spanish, but he accepted to go in and take my curriculum, the NDPP, and he actually improved his health. A lot of families obtain benefits, but I'm so proud of have my husband now as a role model for me at home. I will be here a few more years. I don't know how long, but I always like passing the experience to other people. And now I see community centers very active with Zumba. Zumba was like the big thing I really enjoy from RCHF because my dream was to see people in the community active. And now there's like 7 community centers active with Zumba. That's the big movement that my coworker Elia and I brought for the first time to RCHF. We were the first people doing this activity. Now people is crazy about the Zumba. They really enjoy that. And I enjoy seeing them active. And I told our previous CEO, I want to retire from here. And he says, if you still can hear and move. Okay, yeah, of course, I can still move. I have my first grandson and I'm able to do a lot with him, so yeah. Thank you. Is it mariachi coming or something? Hola, soy Francisca Beltrán, soy una trabajadora comunitaria y una promotora de salud con la Fundación de la Salud Comunitaria de Riverside. Empecé a trabajar en el día 11 de julio del 2005, hace añitos. Empecé trabajando 10 horas y después 20 y después fuimos aumentando el horario. Nos adoptó la fundación después de algunos años como promotoras de tiempo completo. Y mi trabajo como promotora yo lo hacía ya antes en México, sin recursos, sin fondos, sin dinero para poder compartir lo que ahora la fundación comparte lo que comparto por parte de la fundación en educación básica y con ejercicios. Todo lo que hago de parte de la fundación lo llevo a la comunidad con mucho gusto. Como promotora disfruto. Mi parte favorita de trabajar en esta fundación es que he mejorado mi salud en general. Mi salud física, mi salud corporal, mental. Durante mi tiempo trabajando aquí con la fundación y después de muchos años, mi familia se involucró en mis clases de educación. Quiero platicar algo acerca de mi esposo que estaba en la etapa de la prediabetes y lo invité a incorporarse en el programa nacional de prevención del diabetes y aceptó. Era mi primera sesiones en inglés porque yo regularmente hago mis sesiones en español y lo invité, aceptó y siguió el programa y pues gracias a este programa salió el rango del diabetes, ya del prediabetes. Ahora estamos siguiendo otras clases con otras personas y él tomó lo básico y es lo que me impactó de él, de que aceptó estar en una de mis clases y juntos trabajamos para que él saliera de ese rango. And I told our previous CEO, I want to retire from here. And he says, if you still can hear and move. Okay. Yeah, of course. I can still move. I have my first grandson and I'm able to do a lot with him. So, yeah. Yeah. Thank you. Is it mariachi coming or something?